So now we're going to move to our second panel, supporting performance and health of female athletes. And I'm joined by Dr. Kate Ackerman from Boston Children's Hospital, Dr. NiCole Keith from Indiana University. She's the past president of the American College of Sports Medicine, and Dr. Emily Kraus from Stanford University. Thank you all for being here. Thanks also for the audience. Great questions coming in. I'm trying to get to as many as I can. But let me launch quickly first to you, Dr. Ackerman. What are some of the unique challenges faced by clinicians, including yourself, treating female athletes and researchers studying female athletes?
Well, there's so many. It's why our work will never be done. If we start with, say, the perimenopausal or postmenopausal woman who wants to stay active and wants to know how to keep on muscle mass, how to stay strong and stay really involved in her sport. We talk about a female athlete who is getting pregnant and wants to know how much she can exercise during pregnancy and how pregnancy will affect her. We talk about athletes who want to know how their menstrual cycle will affect their performance. So many of these questions haven't been completely answered, and they're very hard to answer because they take a lot of time, a lot of resources to really study the menstrual cycle in these women.
Great. Other challenges, Dr. Keith?
Sure. So one challenge is that it's important to remember that girls and women at different life stages are very different. So if you're looking at a little girl compared to an adolescent girl, compared to the other stages that Kate mentioned, they have to be treated differently. And so it's really important to remember that children aren't small adults, girls are not small women.
What about, let's dive into one of these challenges a little bit more. What are some of the solutions that are emerging? Anybody want to jump in?
Yeah, I can chime in. I think one of the challenges, especially as a sports medicine physician who sees these female athletes who present to my clinic with an injury, the question is, how could we have intervened sooner? What are those risk stratification tools? And unfortunately, as Dr. Ackerman had mentioned, there is a large research gap. And I think it starts by finding out, asking the right questions, and then studying them thoroughly, and really taking into account some of these nuances within the hormonal cycle. And that changes, as Dr. Ackerman had mentioned, from adolescence to a collegiate, post-collegiate athlete, premenopausal, pregnant athlete. And we really need to dial in and really understand those questions and take it to that next level. And I'm sure Dr. Ackerman and Dr. Keith can really talk about some solutions in more detail as well.
Yeah, great. So Kate, just jump in. What are some of the things you're studying, exciting findings that are actually beginning to get translated?
Yeah, so I think one of the things all three of us are interested in is bone stress injuries, stress fractures, female athletes. We see these a lot, time and time again. And so we might see a female athlete who's not eating quite enough for how much she's exercising, inadvertently or not. And then she has menstrual irregularity, and that correlates then with her being at a higher risk for a stress fracture. Then once she has the stress fracture, how are we getting back? How are we improving the nutrition? How are we improving the bone density? And how are we returning her to activity? And so we've done some studies looking at bone density and bone quality in stress fractures. So for example, with tibial bone stress injuries. And what was really interesting to me as a clinician is that we found that over 12 weeks, the bone microarchitecture actually got worse over those 12 weeks while we're trying to rest the person and then bring them back to activity. As a clinician, we usually think that by 12 weeks, you can get back to running. But what we saw was that bone needed to recover. So here's a great opportunity for us to determine how much loading should we be doing? What kind of rehab can we be doing? Should we be doing partial weight bearing to get these people back to their activity so they don't have yet another injury?
And Scott, I'm going to just jump in because as the non-physician on the panel, one of our concerns is about access to care and meeting girls and women where they are and getting into communities to make sure some of these problems are invisible until they become very visible and problematic, and making sure that there is a prevention going on with these women so that we can avoid injuries, but making sure that we're getting to them where they are and not waiting for them to go to the physician.
And Dr. Keith raises a very good point. One of the alarming statistics is that girls drop out of sports at a rate of 2 times versus boys by the age of 14. And I think a lot of that is related to access and resources. And Dr. Keith is a physical activity researcher. So I think really understanding how to encourage and promote physical activity through those resources is really important to getting to the solution.
So one of the challenges is that some research findings don't make it into the clinic or onto the playing field. And I'm wondering how we can translate these new findings, like Kate, you're saying about maybe pure rest isn't right. There needs to be some loading so you don't get the absorption of the bone. How do we translate those findings out to the clinic and to girls and women?
Well, I think we have a lot of opportunities for that. We started a female athlete conference in 2013 that we do every other year. And that was really to have a forum to bring researchers together so they could come up with ways that they could collaborate, but also to get that information to the athletes, to the coaches, to the parents, to the other physicians that aren't studying this. And so we've been doing that for a while, but I think now we're even getting more accessibility with social media and making sure that we have online platforms. And I think Emily can speak about that.
Yeah, one of our big initiatives, thanks, Kate. One of our big initiatives is to create a platform to translate all of this important research coming from all of you on female athletes and performance, where athletes, coaches, parents, practitioners can get the latest cutting edge information to enhance the health and lives of women in sport. For example, menstrual cycle and that topic, as it relates to injury and performance, can be really confusing and challenging to interpret for an athlete or for a coach, a strength and conditioning coach, to really prescribe the best exercise for that athlete during different stages of their cycle. In addition, and we're also covering a lot of fueling strategies and talking about the importance of nutrition and fueling to really set yourself up for success to reduce injury risk and perform well.
I love that combo. It's not just reducing injury risk, but you've been teaching me that stronger is faster, not lighter is faster, and I think that's a key message. You know, we have a bunch of questions coming in from the audience. I'm going to ask them now. So Bev Smith asks, is there an opportunity to understand and study the effects of childhood activity on future health performance? For example, building bone health early. So Dr. Keith, you want to take that one?
I sure will. And not only is there an opportunity that's being studied, it needs to be studied more. We know that an active child who continues activity through adulthood reduces all kinds of chronic disease. And so it's really important to give opportunities to be physically active at a very young age, and then encourage and support that as girls and women grow.
Great.
Yeah, I think diseases like osteoporosis, I've completely shifted my thinking about that. I think of that more as a pediatric disease. We should be doing as much as we can to build the bone density of young kids and adolescents, because there's a window when they get to their peak bone mass, and it happens when much younger than you would expect, in the late teens and early 20s. So if we're getting these kids active, like NiCole is saying, that's really going to be the key.
Yeah, and a lot of the preliminary research does support, in addition to nutrition, to help optimize bone health, but even in participating in different sports and multi-directional sports. And I think that is a really important area to study, is especially as sports specialization and over-specialization is becoming more prominent in athletes at that age.
So we have a question on exactly that topic. Thomas West is saying, hoping that this research could illuminate benefits, or more importantly, risks of all year, all the time youth sports activities where the season never ends. Could any of you comment about that?
Yes, I mean, there are people working hard to demonstrate that that is the case. I think if you talk to pediatric sports medicine specialists, we know this. These are the injuries that we see. We are constantly trying to compete with the clubs and the competitions who want kids to excel too early and not give them a chance to develop, get different, like Emily said, multi-directional activity, a chance to recover, a chance to really enjoy what they're doing so they don't suffer burnout. So we know from a pediatric lens that that's important, but we have to shift the thinking so that people will realize you will still be a really successful athlete later on if you're doing lots of different things at a younger age.
really touching on all of these other aspects, that it's not just about the training, what you're doing on the field, on the track, in the water, but what you're doing on in the other time, that off season, that strength training, the sleep, the nutrition. And I think that there are so many of those topics being covered with the different institutions involved in the Human Performance Alliance. And I'm excited to see everybody dive into that.
I have to also revisit what Emily said earlier about it being fun, and that it's really important, especially for kids. It's about friends and fun, and that's why they're participating in the sport. And so it's really important also when we're talking about year-round to make sure that it remains fun. As a mom of 2 collegiate athletes, it's really hard to get them to do a different sport. They love their sport, but I want to make sure they're still having fun.
So yeah, one of the things that you all have pointed out to me is the link between mental health, behavioral issues, nutrition, and injuries, that they're all linked. It's scientifically very challenging to address and really does require a multidisciplinary approach. So happy to have you on the team. So another question from Adam H. I'll just read that out. An important part of successful clinical treatment and translational research is dependent not only athlete and caregivers, but also on the athlete's larger community. Do you plan to look at outreach and education efforts, especially for historically underserved communities?
So Scott, I do that now, and I plan to continue to do that. It is really important, especially in low socioeconomic status communities, that we understand schools have less resources, there are less opportunities for both boys and girls, but especially girls, to participate in sport. And that community involvement and that community access is incredibly important.
Yeah, I agree with Dr.
Go ahead, Emily.
I think we can all speak on the importance of this topic, and making sure that all of this amazing research is getting translated and disseminated into the hands of the people, and in the hands of the people that really need to hear it the most. And working with Dr. Keith and Dr. Ackerman on this platform to find ways to make sure that the coaches and different coaching organizations have access to this, to that, and to the parents too. I think that's a really important piece of this.
Kate, we have just one final minute here, and I'm wondering, part of this translation, you've really spearheaded the Female Athlete Conference. I wondered if you could talk a little bit about that, what some of the latest discoveries that you just ran that conference last month, and what were the exciting new results?
Well, I think one of the things that was really exciting and surprising to us through this pandemic was how much we can connect with people over Zoom. So this was the first time we did our conference virtually, and we had people from 32 countries. We had people from 40 states in DC. And what it really did was establish more collaborations. So a lot of the people that I do research with, I've met through various organizations like the American College of Sports Medicine, or with this conference. And so now we have people working on the same problem together. So colleagues in Australia, in the UK, in South Africa, and in Canada, wanting to study different populations from different backgrounds with different experiences, and looking at, for example, one issue, the menstrual cycle. So how does the menstrual cycle affect performance in a soccer player in South Africa? How does the menstrual cycle affect performance in rowers in Canada? So a lot of this is really just getting the right people in the right room, whether it's a virtual room or it's an actual room, and having these minds come together to really attack those questions. And a lot of that was focused on at the conference.
Emily, I know you attended. What were highlight research finding for you from the conference?
You know, I think that the interdisciplinary component of building a female athlete program was really emphasized at the conference. For example, there were speakers from backgrounds from dietetics, from mental health specialists, physical therapists, and all of those pieces are really important to deliver the best care to a female athlete, and they can all contribute really well to provide the best care head to toe. And I think one of the other unique aspects was this coaching perspective that really came forth within the Female Athlete Conference. So a lot of coaches attended, and they were really eager to learn. And so finding ways to kind of speak that language of the coach, which is a little different than the patient or the parent or a physician or colleague. And I think that's a nice reminder to us all when we are sharing this information out into the world.
It's fantastic. And I know the coaches care about performance and about winning and about getting the best athletes to participate. But I think your ability to show that performance and health go together, and resilience of girls and women who are performing, I know it's an issue here at our university, and I'm sure it is everywhere. Dr. Keith, last comment goes to you. Anything you want to say to the hundreds of people listening at this moment?
Sure. I just want to talk about the power of social media in good ways and bad, and that lots of girls especially are getting their body image from what they see in social media. They're also getting their science from social media. And so it's really important for us to continue to push out information that is accurate, that's based in evidence, so that we can kind of help these girls and women understand what the truth is in terms of performance and in terms of health and in terms of their body image.
Thank you so much, all of you, for all those thoughts. You know, one of our biggest mission here in the WUSA Human Performance Alliance is to be an authoritative voice for a true scientific information that can guide, and really appreciate all of your leadership in making that happen. Thanks so much.
Thank you.
Thank you.